Good afternoon, this is Dr. Do again. This video is Quarantine Special Edition video number 14. Today I'm going to talk about exercise because the quarantine time it's a good time for everybody to exercise. You all know it, you probably have personal trainer, but I'm going to talk about it in terms of medical standpoint. There are different kind of exercise. What is good for depends on your age. What kind of the mechanism the exercise do good for you in addition to lose weight, maintain the body shape, in the healthy, keep you happy and healthy. Basically, all kinds of exercise is in addition to lighten up your brain, raise up your mood. Basically, they all challenge heart in different way. For example, there are static exercise versus dynamic. Static exercise, what is referred to, for example, weightlifting, rafting. These kind of exercise, they basically challenge heart in the way similar as hypertension. Why? Because this kind of exercise increase the peripheral resistance. So which means your heart constantly contract, pump the blood out with overcome of the resistance from the blood vessel. This kind of static exercise really is increase the blood pressure, so your heart has to work harder to contract. But for the young people, this is good because you're young, your heart will get used to this challenge, build up stronger and stronger muscle strength for the heart to contract. So this is very good for the young people, for the static exercise. Dynamic exercise, on the other hand, which is increase the blood preload, which means, the blood circulates from the heart to the blood vessel back to the heart. If the preload, which means how much hold it in that left ventricle, for example, the chamber, before pump out to perfuse the body, the bigger the better in normal range for normal heart. So the dynamic exercise is really challenge heart in this way, which is benefit, especially in the long run, because you have more blood filled, more volume to start with. Okay, so when your heart contract, the blood flow is more, so perfuse better. So in the other word, dynamic exercise is good for people with heart problem or elderly people. Okay, so what kind of exercise is static? What kind of exercise is dynamic? Actually, in terms of that, I think the sport trainer or the fitness people, they might know. But I can think something like I said, weightlifting is one, and the rafting. Anything to exercise your six packs. Those kind of exercise is the static. Okay, they might have the component of dynamic, but majorly are the static. What kind of exercise is dynamic? Basically, you use your extremities, lower extremities, and again, both of the dynamic and static exercise could come together. Just which one has the more component of dynamic, which one has more component of static. So jogging, for example, start from young, especially for the older people, jogging, long-term running, or long-term walking. This is very good for the heart, challenging heart. But some people are very strong, even though they're older, 60 years old or 65, still feel like that's not enough. If that's the case, you can do whatever suit for you because everybody is different. But in general, especially for those older people does not do exercise frequently, I do not recommend start static exercise when you're getting 60 or 65. When you're young, you can do any kind. You can do static, dynamic, with your preference because you have potential, your heart is normal, your heart is strong, and I do recommend static, however, for the young people because you challenge your heart start early time. So your heart is really build up the strength So when you're getting older, you transition to the dynamic. So will really sustain the heart strength. Again, so this is the exercise I'm talking about for dynamic or static. For female, I like to talk something to women, either young or older, particularly older women. I really just recommend slow jogging. Unless you're very athletic, when you were young, you were running marathon, and you just kept running and you can continue. Other than that, a lot of women used to have sedative lifestyle. When the children are grown up, they think they have their time to exercise. So I recommend do not start with something really vigorous. Gradually pick up the pace. Either slow walking as a good start, and then pick up the speed, walking faster or longer. So this is give yourself a space to gradually your heart gets your heart gets used to it. And for the young female, especially for the overweight young mother or young female overweight, I recommend the long jogging with moderate speed that you can tolerate. This is just in terms of your because like I said, what's the good way to burn the fat? The long term, the time. If you do the 5 minutes very vigorous exercise, does not burn the fat. But if you do 30 minutes moderate strength to sustain, this is the way to burn the fat tissue. Of course, if you can do a 1 hour long, sustained, slow. So this is just different way in terms of medical standpoint and metabolic mechanism, how to do the exercise. Especially this is the quarantine time, the weather is getting warmer and comfortable. I'm sure many people think about exercise, try to choose. On top of that, talk to your physician if you are not active people, or talk some professional, the fitness or the trainer. They might give you some idea. Again, this is just Dr. Doe talking on the medical standpoint or the metabolic mechanisms to recommend what kind of exercise you can take. You can try. Thank you for watching, and I will see you next time.